50 years ago, in a medical emergency, who would you turn to? Today, we all take EMS for granted. But before 1976, volunteer and paid rescue squads provided all emergency medical response duties in Wake County.
Back then, it was funeral homes that came. In Raleigh, it was Beacon Ambulance Service until everything started to get organized and the rescue squads and Wake County EMS and everything started coming up online.
As our community grew, Wake County commissioners decided it was time for a unified mission. And on July 1st, 1976, Wake County EMS was born with 4 trucks and 24 employees.
Community was used to having a truck designated for each area. Well, with the merger, that was going to go away. I mean, they were still going to have service, but it was going to be the closest truck that would respond. You got to remember, too, that in these small towns, you know everybody. You see them at the diner. You responded to their house 2 days ago. It's more of a personal thing, too. We used to run, on average, 950 calls a year. 1 year, I ran each call.
Just 5 years later, in 1981, Wake County EMS entered a new era with advanced life support. Wake County EMTs began to treat patients with more complex equipment and skills.
At the time, there were 9 rescue squads and the county service. County service only provided for the city of Raleigh. I was hired to upgrade the program from basic life support to advanced life support. All the crews are taking part in education for EMT intermediate.
So when you're operating at the EMT level, emergency medical technician, which is the basic care, particularly back at the time, you're responding to a patient and you're thinking in terms of basic support functions that we're going to do, bandaging, splinting, oxygen, and then we're going to gather information and we're going to take that person to healthcare.
In 1984, under the guidance of Director Gerald Brown and the recently created training division, Wake County EMS reached another milestone by introducing paramedic service, further increasing care for patients.
When you become a paramedic, it's a different approach. Now we're thinking in terms of, I am bringing healthcare to the patient's side wherever they lie. A heart monitor and an EKG and interpreting a rhythm and making treatment decisions based on what I'm seeing. So it's a completely different frame of mind as you respond and think about the things that you're going to do as far as clinical intervention goes.
Under the Blue Ribbon proposal that was done, they decided they wanted a paramedic on every truck in the county. I think that was one of the most defining moments that the county said every citizen should get a paramedic.
With the turn of the millennium, Wake County EMS brought on its first full-time medical director, Dr. Brent Myers, who continued to push for an even higher level of care for patients by focusing on clinical research.
Dr. Myers was just really fun to listen to. He was a very captivating speaker. When Dr. Myers came in the room and talked to you about a new clinical venture or a new data that had surfaced, maybe from a conference, people listened and they were really eager to put those things into practice.
He could lead you into believing what EMS could be.
So we did see a surge in survival in cardiac arrest starting in that mid-2000s timeframe. And it goes back to that evidence-based medicine that we were talking about before.
Our advanced practice paramedic program that was initiated in 2009 has seen wonderful things for the community. Reduction of transports, dealing with specialty populations.
It was a way for us to be able to get a paramedic to a high acuity call, but it was also an opportunity for us to be able to meet the needs of those that were calling 911 a little bit better, because everybody doesn't necessarily need an ER.
We are able to successfully divert mental health and substance abuse patients to the right resource and to really connect patients who have very clear gaps in their social determinants of health to the right resources is actually making a much larger impact now because we're focusing on what we know we're good at.
As Wake County EMS entered its 5th decade, leadership turned to new technologies and practices to support staff well-being and make responses more efficient. Now, Wake County EMS is an industry leader in peer support because of recent initiatives like its therapy dog program.
Wake County EMS is well positioned for the future in regards to things like continuing to develop new approaches, new innovations, and continuing to contribute to the EMS profession as a whole, as we've done for many years.
Use of lights and siren and cutting back on emergency response, using EMD as a basis for that, and allowing for what we call a cold response. 911 processes the call. We categorize non-urgent, non-life-threatening events and let the crews respond without lights and siren. We studied that and showed that it's not a detriment. You see the program is going to expand to reduce lights and siren a significant amount.
Wake County EMS has done a great job communicating with their employees on what's new, what might be coming, and what the expectation of how to protect ourselves and the citizens would be.
Through COVID and certainly the vaccine clinics and even the other EMS personnel that assisted, I think it cemented our position in the county as a department as not just an EMS service, but really a public safety partner.
When I started, there were no cell phones. There were beepers and there were radios. Zoom ahead to today where you have electronic documentation, much expanded education, professional education department, the use of simulation, the changes of technology. This is great. This is going to save lives.
50 years of care, service, and excellence is just the beginning. Now and forever, Wake County EMS lifts up our community through a culture of care that never compromises.